Brittany Master, and I go to ARIA School of Nursing. I wanted to be a nurse because I have a few people in my family were nurses, and they really enjoyed their job, like from what they said to me. And I went from community college into ARIA, and I don't know, I was in the teaching program, and then I switched to nursing. I don't know, once I got into it, I really liked it. I would say the nurse's responsibility is to educate on health, labor and delivery. Why? Because I don't know, I have an aunt that does that, and she really likes it. And I did my clinical rotation there, and I really liked it. I really enjoyed being a part of that. 5 years, I would like to at least have my bachelor's, because with ARIA, it's a associate's diploma school. I'm a caring person, and I care about other people, and like being a part of that and making people feel better about themselves. A planner and all that stuff, making sure like mapping it out day to day, setting like time frames. Doing things that aren't school related, meaning like working or like just relaxing. Competition, for one, because of the economy. I think it's once you get out of school, it's a little harder to find a job. And I think other challenges, I think like with Temple, I heard like with the amount of patients given. Like I think some hospitals, they have policies on how many patients each nurse has, and sometimes they don't follow that. That never really crossed my mind. Maybe when I was a child, I always said like a pediatrician, but going to school, going to clinical, going to work. I like coming to the schools. That's interesting. From other schools, from a diploma associate school compared to like a bachelor university, it seems like we get more clinical hours. So we have more like in the hospital time rather than they have more classroom time. So I think when it comes to that, I think we have more experience in the actual clinical setting compared to others. Dedication and perseverance to finish school and to go further on in my education after. Procrastination. I like do everything last minute. Most I like about nursing would have to be, I guess, the result from what you do at the end of the day and how you impact like your patients, or it's also even seeing different things like with different diseases, different. So it's interesting. I mean, it's rewarding because you learn so much. Probably working holidays, because I think you're within a year you have to work at least 2 holidays, or if there's Christmas and Thanksgiving, you have to do one of them. I would just get everything done ahead of time. It's going to take a lot of time out of your day and the time that you're there. You might have to miss some things that you really want to do, and you just have to be mentally prepared, because it's draining. every day, especially like test weeks. You know, it's and finals. Like after, when you're done finals, you're just like, you just want to celebrate. To be prepared for the work that's ahead, and prepared for what you're going to see and what you're going to do. You can't really be too prepared for it, because you're going to like learn the basics before you even go into like doing like more challenging work. But just to be prepared for the lecturing, your long lectures. You're like, you do 3-hour lectures, sometimes 4. Just that it's a lot of work, and you just need to not go into it thinking it's going to be not doable, but go into it knowing that it's, that you have to push yourself and work hard.